Hello everyone. In this video, we're gonna be looking at a few previous year questions from the subject of physiology. So let's start with the first question. What is the neurotransmitter responsible for small intestine anterograde dilation? Is it VIP? Is it acetylcholine? Is it neuropeptide Y or substance P? So let's quickly review the process of peristalsis. What is this exactly? So you must be knowing that in the intestine, whenever we take food, the food has to go in the forward or anterograde direction. Now, how does this happen? So, behind the bolus of food, there is a concentric ring which is formed, and this is formed due to certain neurotransmitters. At the same time, in front of the bolus, there is dilation of the intestine. So, this way, the bolus of food can be pushed forwards. And so, we can say that the food propels in the chordate direction. Now, what are the neurotransmitters acting here? So behind the bolus, as we saw, there was a concentric ring that was being formed. This is formed due to acetylcholine, neuropeptide Y and substance P. If you remember, all of these three were given in the options. So these three are not the correct answer. In front of the bolus, as we just saw, dilation is seen. This occurs due to vasoactive intestinal peptide and nitric oxide. I've even added reference here, and I've added reference to most of the questions so that there is no confusion. So since VIP was in the option and the question asked anterograde dilation, so this is caused by VIP, so our correct option is option A. Now, what type of neurons are responsible for firing mainly during forceful expiration? Pneumotaxic center, ventral group of neurons, dorsal group of neurons, or chemoreceptors? So let's see the definition of each of these options one by one. So what is pneumotaxic center? So it is a center which is located in the pons and it is involved in controlling the duration and the rate of breathing. So this is not the correct answer. Chemoreceptors? These are receptors which can sense the changes in blood gas levels and accordingly they can change the rate and depth of breathing. Dorsal group of neurons, they primarily regulate the inspiratory phase of breathing. So these three are not the correct options. But what about the ventral group of neurons? What are they? So during normal quiet respiration, these are almost totally inactive. And in normal quiet breathing, the dorsal respiratory group sends repetitive inspiratory signals that activates the diaphragm. And because the lungs have the ability to recoil, this elastic recoil of the lungs and thoracic cage causes the expiration. So this is what normally happens. These are neurons which can contribute to the inspiration and expiration, both of them. But their most important function is to provide powerful expiratory signals to the abdominal muscles during very heavy expiration. So if we go back to the question, it was being asked the neurons which are responsible for firing mainly during forceful expiration. And so our correct option is option B. Now, which of the following has the least conduction velocity? Is it postganglionic sympathetic fibers, preganglionic autonomic fibers, somatic motor fibers, or touch and pressure fibers? So I've taken a snippet of this table directly from the Ganong's book. So let's find our options one by one. So here we have the somatic motor fibers, and as you can see, it has a maximum conduction velocity. Touch and pressure fibers also have a high conduction velocity, and preganglionic autonomic fibers also have a conduction velocity of 3 to 15 meters per second. But if you see, postganglionic sympathetic fibers out of all of these four are the slowest. And this was in our options. So coming back, since the slowest was being asked, our correct answer is option A. Now, Brown-Séquard syndrome is characterized by fine touch lost on the opposite side, only pain lost on the same side, pain and temperature loss on the opposite side, or pain and temperature lost on the same side. So if I'll go and explain about Brown-Séquard syndrome in detail in this video is going to be very long. So if you want me to make a separate video on this topic, please let me know. Right now, I'm just going to focus on the main points. So what is this syndrome? It is also known as the hemiparaplegic syndrome, where half of the spinal cord is damaged. So as you can see in this image, half of the spinal cord is damaged. So this is the dorsal side and this is the ventral. So the dorsal column tracts of one side are damaged along with corticospinal tract and spinothalamic tract. It is because of these three tracts being damaged that we will see the symptoms. Now let's quickly revise what are the things that are carried by these tracts. And what will happen if we damage these tracts? So upon damaging corticospinal tract, the person will have ipsilateral flaccid paralysis at the level of the lesion and spastic paralysis below the level of the lesion. Upon damaging spinothalamic tract, the patient is going to have contralateral loss of pain, temperature, crude touch, and pressure. Upon damaging dorsal column tract, the patient will have ipsilateral loss of fine touch, proprioception, vibration, and stereognosis. So let's try to focus on our options here. As you can see, contralateral loss of pain and temperature is seen here because the spinothalamic tract is damaged. So coming back to our question, here the correct option will be option C, which says pain and temperature loss on the opposite side. Now, when the values of FEV1 is 1.3 and FVC is 3.9, which of the following does this signify? Is it normal lung function, obstructive lung disease, restrictive lung disease, or both? So what is FEV1? FEV1 is the forced expiratory volume in 1 second. So you will ask the patient to breathe in and then you will ask the patient to forcefully exhale. The amount of air that he can exhale in the first second is the FEV1. What is FVC? So it is the amount of air that can be forcefully exhaled from your lungs after taking the deepest possible breath. Now we can find out if a patient has obstructive lung disease or a normal lung function based on this. If we will take the ratio of FEV1 and FVC, and if it comes up to be more than 0.7, it is normal. But if it is less than 0.7, the patient has obstructive lung disease. So we just have to put the values that were given in the question here. And upon doing so, we will find out that the ratio is actually 0.33 or 33%. So this shows us that the patient has obstructive lung disease. So coming back to our question, our correct answer is option B. C-peptide is seen in pre-proinsulin, proinsulin, a gastrointestinal proactive molecule, or as a combined entity with insulin after secretion. So to understand this, we will first have to know the production of insulin. So at first we have the pre-proinsulin. This is converted into proinsulin, which has 3 chains. Chain A, B, and C. And then this proinsulin is finally converted into insulin by the removal of the C peptide. So this is the order which you have to remember, which they might ask in the future exam. So according to this, you can see that the C peptide is removed from proinsulin and it is not removed from pre-proinsulin or insulin. So coming back to our question, our correct answer is option B. Calcitonin levels are increased in hyperthyroidism, hypoparathyroidism, Cushing syndrome, or hyperparathyroidism. Okay, so what is calcitonin and what is its normal function? So its normal function is to reduce calcium levels by blocking the breakdown of bone and preventing the kidneys to reabsorb. It is mainly secreted by the parafollicular cells, also known as the C cells in the thyroid gland. And so obviously it will increase when there is hyperthyroidism. So an easy question, our correct answer is option A. Which of the following factors primarily determines the afterload on the left ventricle during systole? Is it stroke volume, heart rate, blood viscosity, or systemic vascular resistance? So what is afterload? So it is the resistance that the left ventricle of the heart must overcome to eject blood in the systemic circulation during systole. And it mainly depends on the systemic vascular resistance. So if a person has high systemic vascular resistance, the left ventricle is going to find it harder to push blood through it, and so we can say that the afterload will be increased. Coming back to our question, our correct option is option D. During a muscle contraction, which molecule binds to troponin, allowing the myosin heads to interact with actin and initiate the sliding filament mechanism? Is it ATP, calcium ions, myoglobin, or acetylcholine? So let's try to see the normal actin myosin filaments. So here, as you can see, this part is the actin and this is the myosin. Myosin has these myosin heads, and in the actin part you can see this pink thing which is the troponin and this long protein called the tropomyosin. So let's see normally how the contraction takes place. So whenever the action potential reaches the muscle membrane, calcium is released. This calcium will go and bind to the troponin C, the small pink thing that we just saw. After this, the tropomyosin, which was the long thing, will move from its place exposing the binding site. The myosin heads will then attach to these binding sites and then the contraction can take place. So as you can see, all of this starts when the calcium is released. And so our correct option here is option B. In the context of the respiratory system, which type of cells in the alveoli produce surfactant, a substance that reduces surface tension and prevents alveolar collapse? Is it type 1 alveolar cells, type 2 Clara cells, or ciliated cells? So let's see the function of each of these one by one. So type 1 pneumocytes or type 1 cells, these are the thin flat cells which facilitate gas exchange. They do not produce a surfactant. Clara cells have protective functions and the ciliated cells are not found in the alveoli. These are found in the respiratory pathway. But type 2 pneumocytes, yes, these produce the surfactant. Coming back to our question, our correct option is option B. That's it for this video. If you have any doubts, so please leave them in the comments or you can message me on Instagram anytime. The link to my Instagram is in the description. Thank you.